Countries are shutting their borders to foreign travellers in an attempt to keep out the new Omicron coronavirus variant. Israel and Japan have imposed total travel bans despite World Health Organization advice to keep frontiers open. Scientists are saying it could take weeks to fully understand the variant's risk, but many governments aren't waiting. They're bringing back curfews, mask mandates and new restrictions.
5 p.m. in the Netherlands. A curfew for bars and other venues kicks in, a measure taken to again curb the spread of the coronavirus. The Netherlands has recorded cases of the Omicron variant, all while the world is still battling the Delta variant. For example, here in Germany, with some hospitals at capacity, the German army is transferring COVID-19 patients around the country to any hospital with a free bed. Now Germany also has confirmed cases of Omicron. To slow the variant, the world is going back to familiar measures like curfews, travel restrictions, testing and tracing. But one important tool has not been fully utilized.
First and foremost, highest priority is vaccinate, vaccinate, vaccinate. Boost, boost, boost as much as is possible, because this boosting or vaccination raises the level of antibodies and stimulates the memory cells for COVID viruses. Therefore, this is the police of the immune system that you are reinforcing during that time.
On the other side of the equator, a similar message. South Africa is calling on its people to get vaccinated. Omicron was first detected in the southern countries of Africa. Little to nothing is known about the new variant, how infectious or dangerous it is. But since its discovery, flights from that part of the world have been cancelled or delayed. Travel bans have been imposed on several southern African countries, and tourists are struggling to get home.
It's all very strange. Everything was fine when I flew in on November 11th. There was no hint of this variant. The last 2 weeks in Cape Town have been great. It's my 9th visit in 3 years. They're trying to get the economy going again. Everything's safe. I have a lot of German friends who also travelled here. Everything went mad between 9 and 11 a.m. on Friday morning. It's chaos, incomprehensible.
Those bans are unjustified, say South African leaders.
We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people.
Manufacturers say they have plans in place to adapt their vaccines if necessary. But first, they need to learn more about the Omicron variant.
One of Germany's leading virologists says the Omicron variant should be taken seriously. Christian Drosten said many young people and those who recovered from previous infections were among the early cases.
I'm quite concerned. I'm surprised to see so many mutations. But then again, these mutations are the only things that are observable so far. We can't always know right away what they will do in real life. There have been media reports of the disease leading to mild symptoms, but I don't think there's much substance to that yet. We have only seen about 1,000 cases, and it still has to be observed. We really have to be prepared for all possibilities. What we can say, however, is that infections have been mostly occurring in young people, often in those who have already had the disease and then get it for a second or third time. We really don't know what we're up against yet, but what we can say with certainty is it's better to be vaccinated. And it's even better to have had a booster shot.
Was da auf uns zukommt. Das Einzige, was man, glaube ich, wirklich mit Sicherheit sagen kann, ist.
OK, for more on this, let's bring in Wolfgang Preiser. He's the head of the Division of Medical Virology at Stellenbosch University, and he joins me now from Cape Town. Thanks so much for being with us. One of Germany's leading virologists says, we just heard, that he is worried about the new variant as more Omicron cases are detected around the world. How concerned are you?
Absolutely the same situation. I'm also concerned, mostly because of the mutations that we are seeing. It basically has mutations that we know from other variants, that come with negative effects on transmissibility, vaccine evasion, and so on, and a few more. And what we don't know quite fully is how they work together and what it actually means in practice. So my own lab and other labs around the country are isolating this new virus, and we run lab experiments to determine what it does in cell culture and how well people who have been immunized or who have recovered will be able to neutralize the new virus. That will give very good indications, and this will be complemented by epidemiological studies. And they are also they have started, in fact, to look at cases. And as you said in the report, so far most infections have been in younger and otherwise healthy people. So we cannot really tell how bad it is for those who we know are risk groups. So we are looking at this very closely, and I assume, because of its rapid spread here in the country, that over the next few weeks we will have many more insights.
So it's likely, is it, that this new variant is more contagious than the Delta variant?
It might well be, but we have to keep in mind that South Africa is coming out of a very quiet period as regards infections, and people were quite relaxed about wearing masks and avoiding gatherings. So one always wonders, if you're living dangerously, of course your risk of getting infected is increased. So we'll have to see the full details, but what we know so far is giving reason to be concerned. So I think we better be prepared than sorry afterwards.
Now, what do we know about the efficacy of existing vaccines, and how long could it take to adjust them so that they can then tackle this new variant?
I'm pretty confident that, like with previous variants, and even if this new variant, Omicron, is even worse than the previous ones, the vaccines will still retain a very good degree of protection against severe disease and death. So I fully concur with Professor Drosten that being vaccinated is the way to be, and getting a booster dose when you are eligible for a booster dose is also the best thing to do. However, it may, of course, reduce the protective effect of the vaccines, but it is possible to tweak these vaccines in order to accommodate the new variant. And I hear that this is happening already. That's one of the advantages of modern science, where we can have the sequences within a day or two. They are becoming available worldwide, and they are then used by the manufacturers to look at new vaccines. However, it will be several months until a new vaccine becomes available. So, don't expect any quick solution, and it's certainly not a reason not to have your basic immunization or your booster dose right now.
Mm-hmm. Now, since Omicron was first reported, many countries have restricted travel from southern Africa. South Africa's president says his country is being unfairly punished. Would you say that travel bans are effective and appropriate now?
Well, I'm worried about hearing so many cases being detected. In fact, this is why we sounded the alarm bell early. We wanted to give other countries the chance to be on the lookout for this new variant, and that is happening. And yes, I agree that it feels like South Africa is being punished for doing what all countries should ideally be doing, i.e. look at the evolution of the virus in their population and give alerts to other countries as early as possible. So we are doing that, and we didn't want to create panic. We wanted to give an advance warning to allow others to manage this. And somehow, of course, it feels it's not good. I think one could definitely strengthen travel safety by means other than just blocking travel altogether. For example, testing on arrival is something that is not being done, and that could well be done using the rapid antigen tests. It would only add another 15 or 20 minutes. So that's very easy to do while people are waiting for their luggage. Of course, it needs to be organized, but I think under these circumstances, one could actually allow travel and do it very safely.
All right. Dr. Wolfgang Preiser, virologist at Stellenbosch University in South Africa. Thank you so much for your time.
Well, as the world reacts to the emergence of Omicron, the World Health Organization is holding a special meeting to discuss a possible global agreement on how to handle the next major health crisis. The meeting was opened by the president of Kazakhstan, who said the world was still failing to cooperate. All right, apologies for the sound problems there. Let's get more from journalist and molecular biologist Kai Kupferschmidt, who joins us from here in Berlin. Welcome to DW. How concerned should we be about Omicron?
Well, I mean, clearly we should be concerned. I mean, it is literally called a variant of concern by the WHO as well. And if we look at the genome of this virus, it has a lot of hallmarks of a virus that might have learned to escape immunity a little bit better, that might have learned to be more transmissible. But for now, these are assumptions based on the genome and based on the very limited data we have from what is going on in South Africa. And so to find out how concerned exactly we should be, we really have to wait. We have to do the experiments. We have to see real world evidence. And that's what's happening at the moment. So personally, I am very concerned. I'm still hopeful that maybe it won't turn out quite as bad as some of the assumptions that could be made. But we're going to have to wait for that.
OK, and what sort of timescale does that look like? How long before we know how worried we should be?
Well, it is. So these are different timescales for different questions. I think one of the things we're going to be able to answer fairly soon, hopefully, is how does this particular variant stack up against the immunity that we get from vaccines or from being infected and recovering. And that's really something that we can do in laboratory experiments where we take the blood from vaccinated people and we basically see whether the antibodies in the blood neutralize this new variant. So that is something that maybe in 2 weeks we're going to have an answer, maybe even a little bit earlier than that. There's other questions, in particular, when we look at how severe the disease is, that is much, much harder to parse. I mean, you have to remember also that whatever we see now in South Africa, for the moment, it's based on a small number of cases, and we really have to see. We have to follow these cases. We have to see how many of them are hospitalized, how severe the sickness is. And then you can't necessarily take what you see there and apply it to a country like Germany, where we have had much less natural immunity, for instance, way less infections overall in this pandemic. So that might take weeks to months, actually, to really figure it out.
OK, well, so the WHO has now identified 7 variants of concern. Have vaccines been tweaked as these emerge, or are today's vaccines essentially the same as we were using a year or so ago?
No, for now, the vaccines are the same ones that we've used a year ago. And the reason for that is that if you look at the variants of concern, so far, most of them have had an advantage in terms of transmissibility. Especially the Delta variant, they've been much better at spreading, but we haven't really seen much immune escape. The variant that has had the most immune escape so far has been the Beta variant, which was also first detected in South Africa, and that didn't really spread around the world. But we also know that as immunity builds up in the population around the world, we are more likely to see variants that aren't necessarily more transmissible, or not only more transmissible, but also better able at reinfecting people with immunity. And so it makes a lot of sense that we would be seeing some of these variants coming up now.
Right. And a quick word about travel bans, because the attitude of experts seems to mirror their proximity to affected regions. Those closer say bans are an overreaction, while those farther away say, well, we're going on the precautionary principle. What's your take?
I think there's quite a few experts who, live in regions far away from South Africa and say that these travel bans don't really make a lot of sense. I think the thing is, they can slow down the virus, but that also means that the travel ban has to apply to a lot of regions and not just South Africa. I mean, we have seen this variant now crop up in a lot of places. So maybe what Israel is doing might actually work. But all you're doing is slowing down the spread of this variant. And then the big question is always, what do you do with the time that gives you? And since we're not really doing what we should be doing, for instance, in Germany, in our own country, to keep infections down, you do have to question, how much a travel ban like this is ever going to do if you're not going to use the time.
All right. Good talking to you. Thank you. That's very clear. Kai Kupferschmidt, molecular biologist and journalist. Thank you. Let's take a look at how Omicron is affecting things here in Germany with DW's chief political correspondent, Melinda Crane. Welcome, Melinda. So how is Germany's caretaker government reacting to Omicron?
Well, the fact is that many people see a troubling standstill here in Germany for one reason, because, as you say, we are in a period of transition from the Merkel government, which is still in a caretaker role, to the new coalition that will be led by the SPD's Olaf Scholz. He is expected to be sworn in next week, and he is insisting that his government is going to do everything necessary to fight corona and Omicron. Those public statements are the one side of it, but the fact is his coalition partners are showing dissension and indecisiveness. A new crisis team that is supposed to streamline decision-making by the new government could start meeting in coming days, even before the coalition is in place. But it's unclear to what degree they will act. And meanwhile, the old government is essentially, at this point, biding its time. And an additional reason for this vacuum on the part of both the old and the new government is the fact that they essentially have delegated responsibility to the country's highest court, in a sense. It's going to issue a ruling tomorrow on the legality of past lockdown measures and other restrictions. But again, how the government, old or new, will act on that is an open question. And meanwhile, the head of the German Hospitals Association says the country is walking into a medical catastrophe.
Well, I wanted to talk about that because, as you say, the country's ICU capacity is already stretched. And so one wonders how Omicron is likely to affect healthcare resilience.
Well, in fact, we are seeing intensive care units in many hospitals across the country now at breaking point. The very disturbing word triage is being used for what they're having to do, essentially decide which patients to treat first and which patients to try to send somewhere else. But apparently even hospitals' capacity to do the latter is now at stake. So it is a very serious situation indeed. Quick action is required, and as I said, we're not seeing that from the government at this point.
OK, thank you for that, Melinda. Melinda Crane, DW's chief political correspondent.
And here are some of the other developments in the pandemic around the world. Japan has announced it will bar foreign visitors starting Tuesday as the country tries to prevent the spread of the Omicron coronavirus variant. Swiss voters have backed new legislation where people who've been vaccinated, recovered or tested negative can attend public events. Over 60% of voters backed the new measures. And the World Health Organization will meet to discuss a pandemic treaty. A draft has already been agreed. The treaty would improve global preparedness for future pandemics.